All right, so my name is Jestina-Jocelyn Mponda, and the issue that I will be presenting on is men's mental health. Okay, so the public health issue that will be discussed in this paper is men's mental health, and the question that will be analyzed is how the socio-cultural construction of masculinity affects men's mental health. And this is an important public health issue because suicide rates for men have increased, with depression being the leading cause of their motive to choosing to end their lives. The pressure that society has placed on men to be the provider and breadwinner, protect their families, and be strong has negatively impacted men's mental health and the way in which they deal with stress. Women are often encouraged to speak about their feelings of depression, of anxiety, to seek help, while this same kindness has not been offered to men. Women also have larger networks and support groups to help them navigate difficult things in their lives. It has also been proven that masculinity is a social construct that has been created. It's not something that is inherently put into each individual who was assigned male at birth, but instead it has created a burden that is placed on men and dictates how they should behave, how they should think, and how they should express their feelings. All right, so moving on to stakeholders and a few things that I wanted to discuss here. So social determinants of health in this case play a large role because when you're thinking about economic stability, if people have access to funds to be able to pay for healthcare, that will give them access to seeing a professional, a therapist, a psychiatrist, getting medication if they need to be prescribed medication. That's important. Stable housing is important because people would rather have the ability to pay for their housing, their living conditions, than seek professional help. When you're thinking about the community that you're in, are you in a supportive community? Do you have people around you? Do you have access to things within your community that can help you get the help that you need? And then talking about stakeholders, I have men and boys, women and girls, and like families in general. So men and boys are the biggest stakeholders in this because boys are emulating the behavior that they see in their fathers. They're being taught how to be a man, what they should be when they grow up, how they should behave when they grow up. Oftentimes, boys are told to not cry and are treated a little bit differently than girls are in families. This creates a negative cycle where boys grow up to be men who also cannot share their feelings because this is the behavior that they saw growing up. How this affects women and girls is that little girls grow up and find partners who are similar to their fathers and have similar traits to what their fathers had and view that as being what a man is supposed to be in their lives. How this affects women and girls and children in general, families, is that when men have these suppressed emotions, this can often lead to aggressive behavior being shown within the home and can lead to abuse of both verbal and physical abuse within the home. So the suppression of men's feelings and their mental health affects not just the men who are having these feelings of depression, but the people around them in their families as well. All right. So, the risks that are involved in the social construction of masculinity are that toxic masculinity can affect men who are pressured to act a certain type of way. Toxic masculinity is the way men are culturally trained and socially pressured to behave. And the three core tenets are toughness, anti-femininity, and power, and they all combine to create a sense of maleness. Toughness is described as men being strong, aggressive, and emotionally hardened. Anti-femininity is the rejection of traits that are considered feminine and the rejection of emotion. and the rejection of accepting help from others. And then another risk is alcohol and drug abuse, because these men are self-medicating, trying to help themselves feel better in the process, because they're not receiving professional help, professional prescribed medications. They turn to drug and alcohol abuse, which of course creates even more issues in their lives. And then the last risk is suicide rates, because when self-medicating with things like alcohol and drugs ends up not working, the next resort that people jump to is to take their own lives, because they feel like it's their only way out. Okay. So the policy recommendation that I came up with was to create an option for men to receive private, confidential therapy and access to professional help through their work in order to help create positive habits and deal with mental health. This sounds great in theory, I feel like, but obviously companies need the funding to be able to do this. And I was thinking about it in the same way that some bigger companies have gyms within the company, like within the building walls, that people can access before hours, after hours, when they're off work. In the same way that they can have a couple of rooms with professionals in there that can talk to men just through their issues, give them the help that they need. And then if that didn't work, I was thinking of the workplace having funding to be able to give men the option to seek help outside of work at a therapist or something like that. However, the federal government would need to be involved in this, is what I wrote in my paper. And the federal government's role when it comes to mental health includes regulating systems, protecting the rights of consumers, providing funding for services, and supporting research and innovation. The federal government works to provide and protect individuals with mental health. And I feel as though if the federal government works with states to provide funding to various companies to be able to then use those resources to have professional help for men in the workplace, in the place that they spend the most of their time, place that probably creates a lot of the stress that they have, where they're not feeling weak because they have to seek help where it's not very public. I feel like it needs to be more private, where you can have support groups within your work networks and would be beneficial to them. I feel like if the federal government saw that these would creating a community for men within their workplace would reduce depression, anxiety, and ultimately suicide rates, I think this would be a positive move for them to create safe places for people. Next, I'm going to talk about the couple of the peer-reviewed articles that I had. So a study taken on men who were put into support groups to discuss their mental health issues and share their experiences and feelings found that men who participated in these groups expressed feeling less isolated because they saw that they were not alone, and they saw that other men had some of the same issues and concerns that they had. It created solidarity among the men who were able to be in the study. And they were able to talk through and heal through a lot of pain that they had. The National Health Institute of Mental Health explains that men in their middle ages, and this is described as 35 to 64, account for double the national average of suicides, but are not going in to be diagnosed for depression. And they describe the issue here being there being a lack of attention on men in this specific age group, because they're viewed as people who are independent, who can take care of themselves, who are financially stable, whereas children and women are viewed as people who need support, need to be taken care of, and are receiving this support from men, but it does not seem as though men are feeling as though they're receiving the same amount of support. Signs of depression symptoms and signs of depression in men vary, while our symptoms of depression in men are different than symptoms shown in women. While women show signs of low mood, men, on the other hand, exhibit higher levels of anger, aggression, and irritability, or showcase their depression um, um, in physical ways, such as racing heart rate, digestive issues, or headaches. Um, and then the National Institute of Health suggests that early identification and early intervention is important when dealing with men's mental health. Um, and this primarily means that depression, anxiety, and suicidal thoughts in men need to be caught early, and men need people around them in their personal lives who are paying attention to mood swings, alcohol and drug abuse, changes in behavior, and being there to support them through these emotions, but also encouraging them to seek professional help. It's also important for men um, to receive help um, and have access to help so that they can get to the root issues of their problems and not just on the surface level of what is wrong with them. Men's reasons for feeling depressed vary from person to person. However, they all indicate a need for support, and men needing a community and a support group of like-minded peers who understand exactly what they're going through and can discuss life with one another and create a kind of brotherhood. Community support was a big thing that I talked about in my paper. I feel as though even when you look at widows and widowers, you see that widows do better off when their male spouse passes away because they have a larger um, group of people supporting them. Their children are maybe often closer to their mother. They have larger friend groups. They participate in more activities, so they have more people to support them. Whereas when widowers lose their wives, they're often isolated and don't live um, like don't live life well after their spouse passes away. Okay. So as countries around the world have finally begun to take mental health seriously in the last couple of years, it's time for mental health for all citizens to be prioritized. Men's mental health must be discussed openly in the same way that women's mental health is. And then in the same way that we applaud women for going to seek help, for saying that they have feelings of depression, of anxiety, the same needs to be done for men. I don't think they need to be laughed at or not taken as seriously or told to just man up. I think that access to information needs to be in public places, in grocery stores, churches, barbershops, gyms, in the workplace itself for men to see where they can access help and also for other people, for the entire population to see how they can help men in their life. And I feel like if there are men in your life, you need to be paying attention to signs of depression, signs of anxiety, signs of isolating yourself more, because society has encouraged men to be strong and have a persona that they can handle things, where there might be men in your life that are actually struggling with mental health illnesses but don't feel comfortable to come forward and share things that are wrong with them. Here is my works cited. Thank you. Stop sharing. I'm gonna do stop